your teeth, the relationship between your dental hygiene and your cardiovascular health, specifically the health of your endothelium, like we've always talked about. Remember, the primary cause of cardiovascular disease is a damage to the lining of the blood vessel. And so we're going to show you how dental hygiene can relate to that. Now, here's a quote I just want to quickly read out. It's on your screen. People with gum disease, also known as periodontal disease, have think about that, 2 to 3 times the risk of having a heart attack, stroke, or other serious cardiovascular events. Have you heard that before? I hadn't until a while back myself. Why is that so? Well, there's an interesting link. And now they're studying that a lot more these days. So this is the mouth, this is the blood vessel, and this is the heart. What they're finding out is that gum disease, so when there's gum disease, we all have bacteria in our teeth and in our gums. So what they're finding out is that the bad bacteria, if the teeth aren't well cleaned, if the gum isn't always taken care of, the bad bacteria tend to multiply. They tend to grow. They tend to cause a lot of problems in the teeth. But it doesn't just stay there. So your dentist might look at the plaques and try to address the plaques. What they find out is that the bad bacteria jump into the bloodstream and actually have a predilection for the lining of those arteries, and sometimes even get into the heart too and have infections in the heart. That's a lot rarer, but for the most part, they address or they affect the lining of the arteries, and they can actually begin to cause what is known as inflammation, and that inflammation will begin to cause, again, back to that word again, jaga jaga, on the inner lining of the blood vessels. And again, the process continues, it continues and continues and continues until you have a blockage. I know this sounds strange. If you go online, if you Google it, if you talk to your dentist about it, your dentist certainly knows about it. You will see that it actually does cause that, and there are specific bacteria and viruses that are specifically involved in that. So what they know now is that bad gums, bad teeth, bad bacteria in your gums, in your teeth, can actually cause things like premature labor, premature births. They can actually cause brain disorders. They can actually increase the rate of dementia. They can, obviously, they can cause bad breath, and they can cause even lung disease. So again, you don't want to play around with gum disease at all. And you see some slides and pictures in front of you. There's a direct correlation. I can't overemphasize this enough. There's a direct correlation between good teeth, gum disease, dental hygiene, and cardiovascular health.